All right, thank you for giving me the opportunity to be here. Actually, male infertility has always been around. It's just that because of our culture and because of our belief, our culture always believe that if you have couples that are trying to get pregnant and they have been having issues, it's usually the woman that is the problem. And it's actually not true. It's actually not true. In fact, there are a lot of men that are having or suffering from infertility issues. But I think they are getting more aware that it's not usually the problem of the women. And it's because they are all coming out, at least gradually, to come for tests. If you don't test, you cannot know if it's the man or the woman. Most of the time, the women will come to the clinic, they want to see us. They are usually the one that will go around. How do you see a man start running around that he's having issues, they are not getting pregnant, and it's the woman that will always do that. So you say the definition of infertility is when it's inability of a couple to achieve conception after having adequate sexual intercourse for a period of a year. It's a couple. It's not the inability of a woman or the inability of a man. It is the inability of a couple. So it's a couple thing. So it takes two to make a baby. So that means any of them can actually have issues with getting pregnant. So, and when a man is finding it difficult to impregnate a woman, you say that the man has an infertility issue. So, how will a man know that he has infertility? There are little pointers. It doesn't mean that if the man has that, it doesn't mean that he has. Or if you are seeing such, it doesn't mean that you have. But at least it should give you an idea that, okay, this can be the issue. Now, if the man has problem with achieving erection, erectile dysfunction, and not being able to have sexual intercourse, that may be the problem of the man. Now, if a man decides to have, is having sexual intercourse and is not releasing anything, or whatever he releases is very, very small, has problem with. Hello, are you hearing me?
Yes. Right,
So the last part of what you said,
if it's very small or there is none, when a man ejaculates, it shouldn't be less than 1.5 to 2 mils. When a man ejaculates once, at least it shouldn't be less than 1.5 to 2 mils. Most of the time, 2 mils. But if it is so small that it is not, either it's not coming out at all or it's so small, that man may likely have infertility issue. So those are the little ways by which a man can know that, okay, I'm having problem. Then if the man is not interested in sex, he has a very low libido, it may be that the man has issues with may have infertility issue. Now, there are different causes of infertility in men, and I would like to group them into two broad categories. Problem with sperm production and problem with sperm transportation and deposition. Now, sperm is being produced in the testes. Testes is located in the scrotum. If you see even animals, you will see that male animals, the scrotum is outside the body and is located. The testis is located inside a sac outside the body. So there is always a reason why God placed it like that. So anything that affects that testis that produces the sperm, anything that affects it is going to affect the ability of a man to impregnate a woman. And anything that can affect transportation of the sperm through the pipe that will transport it and to deposition can also affect the fertility status of a man. So what are those things that can affect production? Age is one of them, though it's not as common as in women. But age also affects fertility in men. By the time men are getting to 40 and above, they also start declining. Their sperm production, the morphology of the sperm. If the sperm is normal or abnormal, also starts reducing. Normal sperm starts reducing, abnormal sperm starts increasing. So the age of the man is there. If a man is taking smoking cigarettes causes hormonal imbalance. So cigarettes can make all the hormones to be in disarray. Can also affect. It can increase abnormal sperms. So cigarette, and it's not only if the man is smoking the cigarette. If you are around people that are smoking, because you are taking the same risk. If you have a friend that is smoking, you are inhaling. In fact, your own is worse. Yeah. So it's not that I'm not smoking, but you are always around smokers. You are indirectly affecting your fertility rate or fertility status. Now, alcohol. I'm talking about, these are just normal things, normal way of life of men. Alcohol is also a very an important cause of infertility in men. It also disrupts the hormones. It affects productions. Though some people will say if you take little alcohol, it may not have effect. But as far as I'm concerned, if you're trying to get pregnant and you're having issues, alcohol, as long as alcohol is in the mix, it may be the one that is affecting the sperm. Yeah. Then we have drugs, especially these entertaining drugs, marijuana, cocaine, all these drugs, even steroids. You see some people that are using steroids to build muscle. Steroids affect hormones. In fact, steroid is an hormone. So if you are there is steroids in the body, there are steroids in the body. So when you are taking another kind of steroids, it will affect those steroids that are in the body. And steroids is important for production of sperm. So once you are taking steroids, you are taking marijuana, cocaine, and all those entertaining drugs and all those drugs, they can affect fertility. Then there are some things that hormones generally, if there are problems with hormones are chemicals that control the functioning of the body. And there are different hormones for different system of the body. There are hormones that are particular for the reproductive system of the body. Now, those hormones, when they are affected, it can affect sperm production because the brain will send those hormones down to where the testes are. To the testes to improve to stimulate them to start producing sperm. So if there is any cut between the transmission from the brain to the testes, it's going to disrupt it. And there are some hormones that can affect it. Hormones like prolactin. As much as prolactin affects ovulation in women, can also affect sperm production. Men as well. So if there is high prolactin, it can affect the sperm production in the man. Then if the man has thyroid problems, thyroid hormone is a very important hormone in the body. In fact, it is important in controlling almost every system in the body. So if it is affected, definitely it's going to affect the ability of a man to produce sperm. So that's for hormones. Then we have other things like heat, radiation. Now, like I said, there is a reason God placed the testes inside the scrotum, inside the bag, outside the body, because it has a particular amount of heat that it needed. The temperature for the sperm to be produced, it has a particular amount of temperature that the sperm needs to be produced. Now, if you notice men during hot period and you see the testicle and the scrotum of a man, it dangles further. It's like it's getting away from the body because it's trying to go away from the heat of the body, the core body temperature, so that it can have hair around it, and so the hair can maintain the temperature. And during cold period, you see that the scrotum will go closer to the body because it needs that temperature. So if there are situations that increases heat around the scrotum, it will affect, or around the testes, it's going to affect sperm production. Situations like obesity, if you see men that are fat, the tummy also covers everywhere, everything just, so covering the scrotum, the labs also, everything choking the scrotum, the heat will be high. So it can affect sperm production in obese men. Those that wear nylon pants. Nylon increases temperature around the scrotum. So nylon pants can affect sperm production. Some people there are some arguments against use of hot water, all these sauna, going to hot bath, and all those things. There are arguments against it. But the truth about it is that as long as it's something that is done consistently, you are exposing the testes, you are exposing them to constant heat. Those heats will have effect on DT, definitely. Other ones, radiology, like I say, radiology, radiation. I mean radiation. Those that are exposing themselves unnecessarily to X-rays, this radiotherapy effects on men. It can also affect, like men that are suffering from cancer, and they have to go through radiotherapy. It can affect their ability to produce sperms. And then there are some people that have what we call hereditary or genetic problems, such that their testes is actually either very, very just like a baby testes, or they are not even there. So some people have hereditary, or genetic problem right from birth, that their testis is so small or may not even be there. So in such people, they are not even producing anything. While some can be due to infection. Infection is especially sexually transmitted infection, gonorrhea, chlamydia, all these infections. They can destroy the testes. There's another form of infection, a viral infection. Viral is mumps virus. Mumps can affect the testes, can cause, and usually happens in young boys. This kind of infection usually it affects. You see a small boy, maybe between 9 and 15 or thereabouts. They're just entering puberty, and then they are suffering from this. There's this place that you just found that is swollen and it's painful and tender. They say they have parotitis. If that parotitis is not well taken care of, it can lead to mumps or mumps orchitis is the testes can be inflamed, can be infected as a result of that infection. Yes. If those infections are not well taken care of, it can lead to infertility in later in life. So it's not only when men are already men. Infertility can start from when they are younger. A lot of people have those problems, like they have it while they are younger. And there is one that they call testicular torsion. In fact, it's one of the common problems, especially in younger men and boys. Testicular torsion, that scrotum, they just find that it becomes swollen and it's painful. A lot of people, they will take their boy to the chemist to just give paracetamol, give diclofenac, ibuprofen, and they are ending the fertility career of that boy. Yes. Once you have a boy that has a swollen scrotum and is painful, that boy should get to the hospital within 4 hours. Because if it is testicular torsion means that the testes, there is a connection between the testes and the body. That thing connects the testes to the body. Now, if the testis twists on itself, as it's twisting on itself, it will be twisting on that connection. And that connection contains blood supply to the testis. So as it's twisting on itself, it's closing up the blood supply. So once it shuts off the blood supply, that means that that testis is going to die. Can you hear me? Since my network is... Can you hear me?
Yes, you're back now.
All right. So I was talking about testicular torsion. That if the testis twists on itself and it continues to twist and is not relieved, it's not untwisted, so that the blood supply can resume. If it's not done on time, within 4 hours, that testis will be gone. And once the testis is gone, that is the end for that boy. So if you see...
Sorry, doctor. You're saying that this particular condition that shows in teenage boys, if it is not treated on time, it can have a permanent effect.
Yes.
On the
Yes. The testis will just die. And once it dies, there is nothing else again. You just find that the testis is not growing again. It's just as small as it is. And it can affect the other. Thank God that it's two. Because when it happens and they go to the hospital, they will operate on both and make sure that they are both stabilized, so that it won't, because as long as it can happen in the first one, it can happen in the second one. So that is why a lot of people just take their boy, they will just take to the chemist or a pharmacy around, and they will give the boy drug. They will give painkillers. Once they give painkillers, the boy will not feel any pain again. But the damage is going on, and that damage is permanent. So that one also can cause infertility in men later in life. So those are things that can affect production. Now, what are those that can affect transportation and deposition? Transportation means that during sexual intercourse, once the person orgasms and is releasing sperm, it passes through a pipe and is now released into the vagina. Now, anything that can affect that process can also lead to infertility. So anything that can block that pipe, that means if the pipe is blocked, that means there won't be movement of the sperm. Yeah. So sexually transmitted infection also can block the pipes. Gonorrhea, chlamydia, all those infections, they can block the pipe. And once the pipe is blocked, that's the end. It can be relieved surgically, but it may be difficult. And in some people, they don't even have that pipe. Some people are, as in from birth, that pipe is absent. So they are producing the sperms, but the pipe to connect is not there. And so there are people like that. Now, there are some people also that they are not even able to achieve erection, because erection is needed for sexual intercourse.
Yeah.
And so they are not able to achieve erection. People that are having diabetes, hypertension, heart problems, that they cannot even have sex. Such people, it's not that they actually have the infertility per se, but deposition of sperm is not possible in them because of their state. So those medical problems are the major ones that can cause that. They could also be psychological, erectile dysfunction, psychological erectile dysfunction. So all these together are the causes of infertility in men. So if, like I've listed them out, if there is any man that is having any of these and they're having problem with, in fact, that man should start thinking that maybe he's the one. There's actually the one that has problem. And when you look at the percentage, if you look at in a couple, if you put 10 couples together, 3 to 4, if the 10 couples are having problem with getting pregnant, 3 to 4 of them will be majorly due to the woman. As the cause of the infertility. In 3 to 4 out of the 10 will be from the woman. Also 3 to 4 is also from the man. Sorry, it's also from the man. It's the same percentage as is it from the woman. So they contribute equal causes to the infertility. So it's only about 2%. It's about 2 of them that will be from both. and maybe one of them, you may not even know what is causing their infertility. You just find that everything is fine, the husband is fine, the woman is fine, but they are not getting pregnant. So that one can be unexplained. So how do we now manage them? How do we manage them? First, one has to be sure that this man has the problem. So apart from the person saying that I'm having problem with having, we are having problem with getting pregnant, and I always advise couples that once they have been able to stay together and have sexual intercourse for 1 year, if the wife is more than 35, less than 6 months, once they are 6 months and they have not been able to achieve conception, they should go and see specialists, the two of them. It shouldn't be the woman that will be going around alone. It is very wrong for the woman to be the one going around alone. I've seen situations, I've had clients that the fault was put on the woman. They said the woman is the one not allowing the husband, their children to have baby. And when the man decided to do the test, now found that the man doesn't even have anything. He doesn't have any sperm. So it's the man that's actually having the problem. And the man has been running around, spending a lot, doing a lot of things on her body for no reason. So I always advise, the earlier the two of them go out, the better for them. Once the woman is already more than 35 years, it takes about 3 to 5 years before the woman starts having issues with getting pregnant finally. But if they are less than 35, the woman is less than 35 years, they can wait for a year. But after a year, if they have not been able to achieve conception, they should see a specialist, a fertility specialist. It is very, very important. Now, there are tests that will be done both for the man and the woman. But since we are actually looking at the man, major tests that will be done is seminal fluid analysis. The seminal fluid analysis is just to help to analyze the sperm. They will ask the man to bring the sperm before the
Our connection is a bit testy. Okay, please, can you still hear me? If you can still hear me, because I think Dr. Can still hear me, please say hi in the comment section, and then maybe we can try to reconnect with Dr. Shea again. Okay, looks like Dr. Shea is disconnected. While we're waiting for him to join back, network, be nice, please listen and be nice. Just a few points from all the points that Dr. Shea has made to us. Some of the few things that stood out to me. Number one, in his experience, he has found that a lot of times, because he's a fertility, he's an OBGYN and he's a fertility and conception expert, he finds that women are always the ones coming around, running helter-skelter, looking for solutions to their fertility issues. But a lot of times, the men do not even want to consider that maybe there might be a problem with them. And he gave an example. He said out of 10 couples that are having fertility challenges, 3 are female factor infertility, another 3 are male factor infertility, and then we have the rest, which might be from both sides. So it's clear that, a lot of times it's an equal thing. I think that's what we need to understand, that it's an equal contribution between the man and the woman. It takes 2 to make a baby. And he said something, he said it's called the couple, not the man, not the woman, it's the couple. So it's 2 people and they have to come together. So if, for instance, a couple is having fertility issues or fertility challenges, it shouldn't be only the woman that is going out to seek treatment or seek solutions. It should be something that they will do together as a couple, because it doesn't help the situation if the woman alone is going around looking for solutions to these issues. So another thing that stood out to me, and I think I'm going to tie this back to, okay, Dr. Shea is back. Dr. Shea is back, so we're going to try and connect. We're going to try and connect him back so we can continue.
Sorry, my network just went off.
Okay, welcome back.
Yeah. So, So like I was saying that before they do a sperm analysis, the man will have been told to abstain from sex for about 3 to 5 days, so that there will be good concentration of the sperm. So that, because if he's not abstaining from sex, we would think that the man has issues, because as long as he's having sex and is ejaculating, the concentration of the sperm will not be as much as is expected. So if you wait for about 3 days, there will have been enough semen for us to analyze. So we will do seminal fluid analysis. And what are we looking for? We are looking at what is the amount of ejaculate, that thing that you ejaculate, what is the amount? Is it the normal amount? Like I said, it should not be less than 1.5 mils or 2 mils. 1 to 2 mils, 1.5 mils to 2 mils, sorry. So is it the normal amount? And then we look at the concentration of sperm. That how many sperm, if we count the sperms, how many are they inside that fluid? We have different criteria. There are different criteria. There are criteria that are lower than some, but usually it shouldn't be less than 40 million for the 2 mils and 20 million for 1 mil. There are some that says 15 million, then 38 million, depending on the criteria that it must not be less than 15 million generally per mil. So that means in 2 mils, just multiply it by 2, or multiply in one and a half mils. So at least per 1 mil, the sperm must not be less than my network again.
Yes.
Yeah. So the sperm must not be less than 15 million. So we look at the sperms now. For each sperm, how many of the sperm are alive? Because there are a lot of people that they are actually having 50 million sperms, but more than 90% of them are dead. So if more than 90% are dead, even if the sperm is 100 million, it's useless. So at least about 70% of them must be alive for us to know, okay, this man is fine. So out of those that are alive, how many of them can swim forward? Because once you deposit the sperm in the vagina, the sperm will have to swim up into the womb, to the tube, to go and fertilize the egg. So if they cannot swim forward, there is no way they will move up into the. So some of them will just be going in circular fashion, and some will just stay in one place. So those are the things we look at. Then we look at how many of them are normal. There's some they have 2 heads, 2 tails, and things like that. So you look at, okay, how many of them are normal? Their sperms are abnormal. So you look at, okay, how many of them are normal? Because it takes a normal sperm to actually fertilize an egg to make it to make a baby. So those are the things we look at. And then after then, if you look at it and find out, okay, there are problems with this man, you now look at, okay, where are the problems coming from? If the count is low, if it doesn't have any count, if everything is, if there are some men that they don't have anything, we call it azoospermia. Are you hearing me? Since my network is going on and off. So there are some some men don't even have sperm, they don't have any sperm cell in their semen. While some have very, very low sperm cells. So we need to find out, okay, what is causing it? Why is this man not having? So we need to do other tests. One of the tests is when we send the man for scan, a scrotal scan. There are some things they do on the scan to check. Like there's something we call varicocele. I forgot to mention it earlier. The varicocele means there are veins, vessels that carry blood. Some of these vessels carry blood away from the testes, another one carry blood towards the testes. Now, one of these pipes can become big, and they have many of them that they will now be big like that around the testes. So once they are big around the testes, and blood will now be pooling in them, and because blood is coming from the body and it's not going back, the heat is also on the testes, so it's also causing heat. So we will find from the scan, we'll know, okay, is there problem? Is there varicocele? Are the pipes big around it? Then we look at the testes itself. That testes, are they normal looking, or are they not even okay? So we do those tests. Then we check for some people, all we can do is check the hormone. Like I talked about hormone problem. So we check the hormone. Are the hormones having problem? Are they having issues? So from all these tests, there are some higher tests that are done. We may not be able to do some of them in Nigeria. They check the DNA of some sperms. There are some sperms that their major problem is the DNA of those sperms are bad. So it's from those tests, yeah. So it's from those tests that we know, okay, the man's sperm may be normal, the count may be normal, may be moving well, but inherently the sperm is bad. So from those tests, we'll be able to finalize, okay, this is the problem with the man, or this is what we do, and that's the thing. So from there, we move on. So now to treatment depends on the cause. Treatment of the problem depends on the cause. And like I said, if you are smoking, you need to stop smoking. You need to be away from smokers. If you are taking alcohol, you need to stop them. Once you get pregnant and you have your baby, you can drink anyhow you want to drink. But for that period that you are trying to get pregnant, you need to stay away from cigarettes. You need to stay away from alcohol. You need to stay away from hard drugs, because all these things will affect fertility. If you are obese, you need to find a way to lose that weight. These are important things that men need to do. You need to do all these things so that once you do them, a lot of people, by the time they do that, a lot of them, they get better. If it is hypertension that is the problem, make sure you are well treated. If it is diabetes, take good care of it. Most of these things, by the time you do this, they get better. Now, in some men, all they need is just sperm boosters, just to boost their sperms. Now, there are different ways by which sperm can be boosted. There are food that can boost sperms, especially food that are containing zinc. Zinc containing food. There are some that also there are some food that we call whole grain, like wheat, like rice, sorghum, all those corns. They are also good in boosting sperms. Yes, sperm count and sperm motility and all those things. Then eating good vegetables help with boosting sperms too. So these foods, they are very, very good with helping to boost. And then we have vitamins. Vitamins are very, very important. Vitamin C, D, E, they help to improve the state of the sperm. Folic acid also helps to reduce abnormal sperms. So if you are trying to get pregnant, or a man that you're having this kind of problem, you should try as much as possible to take all these food. They will help to. Yes, it's for men. It's also for men because folic acid is important in producing DNA. Like I said, there are some sperms that have problem with their DNA. Folate is very important in DNA production. So if you are taking folic acid, it's help in building these cells, and it will reduce all these abnormal sperms. So folic acid is very good. It's very good in production of sperm. So like fruits containing vitamin C, citrus, all these oranges and co. They are very good because vitamin C is very good in helping to boost sperm, and it helps with sperm movement. It improves sperm movement. So these these drugs, I mean, these are the ways to, and also maintaining normal weight and exercising regularly. Like I said, smoking and all those things must be stopped. This helps eventually to boost the sperm. However, if with all these things there are still the man still has problem, either that the sperm count is still low or the sperm movement is not as, I mean, it's not improving as it should. There are other methods or treatments that can be done for the man, or to help the two of them to get pregnant. There is something we call IUI, intrauterine insemination. This is when you take the sperm from the man and directly put it inside the womb. You know, normally during sexual intercourse, you put the sperm in the vagina. So it will take the sperm a longer route to get to the womb, to get to the fallopian tube. But in IUI, you are taking that sperm directly. You are going to do a lot of things on the sperm, make the sperm to be optimal and everything. Then you now deposit it directly into the womb. This will help, especially in those that have sperm movement problem. Since the distance that will be covered now you have improved you have shortened the distance the sperm will cover, so it will be easier for this sperm to get to the fallopian tube early. So, but the thing with IUI is that you need to do many before you can say it's not working. You can do as much as 6 to 12 cycles, and you pay per cycle. So that's the thing with it. But at least it has its own success rate. So it's one of those things. The other one is IVF, in vitro fertilization. There are different stages of IVF. If it is just the general IVF, that you just take the man's sperm, that one is important for those that have more severe sperm count. You know, the IUI, you can use it for people that have maybe less than 10 million or around that. It's not up to the normal one, but at least it's still better, maybe more than 5 million. You can still use it for those people. But for those that have less than 5 million, less than 1 million, IVF will work better for them. And in IVF, you take their sperm, you take the egg, and you, outside the body, you fertilize the egg with the sperm. And once the egg is fertilized, it starts growing. So you look at all the embryos and you pick and deposit in the womb for it to grow. Now, there are some people that you can still see that they have far lower sperm counts. But there is still another better method that if you can get one single sperm, it is still possible for that man to get pregnant. So all they need to do is look for a way they will enter the testes and look for sperm. There are methods that we use. They will bring out, if they can see one sperm, they will take that sperm and inject it directly into the egg. So that it will fertilizes. And once it's able to do that, they will deposit the fertilized egg that is growing, they will deposit it into the womb. However, there are some men that you cannot find anything. In such men, donor sperms are the options. They may need to look for donor sperm. There are sperm banks now. People are donating sperms for men that will need it. You just go to the sperm bank, they donate sperm. All you just need is, even there are women that are not even married that are saying that they want to do IUI, they want to do IVF. They will just go to the bank, they will just tell us characteristics of the man I want. I want the man to be tall, to be light in complexion, maybe a PhD holder, and all those things. All those things for each sperm donor, they are all well written out. So when you go there, they will say, okay, this is what they will give you the kind of sperm that that they can use for it. So sperm donor for IUI or for IVF, those are the other options, especially for those that don't have. But the thing about it is that they are more expensive. The higher the procedure, the higher the expense and the amount that you pay. So for IVF, sometimes in the range, it's cheaper. It's getting cheaper these days. At least you can see around 900 now. But if it's just ordinary IVF, that they may not use your donor, they may not use donor sperm or donor egg,
Sperm.
because there are sometimes that you need to use donor eggs too. So there are some IVF that, if depending on if it's just the normal one, that they are using the woman's egg and the man's sperm. Depending on the location. In Lagos, you can see 1.1 million, 1.2 million, and there. But outside Lagos, there are places that do for 900. There are some places that do for 750 outside Lagos. So, and they all have their success rates. I mean, they all have successes. Now, for those that will do